Bismillah ar-Rahman ar-Rahim. I'll start with you with our fourth lecture. It's going to deal with two microorganisms, of course, gram-positive bacteria. The last Streptococcus Pneumoniae, and then we will start with another group of bacteria, and we'll give today, inshallah, the Kerning bacterium Diphtheria. So we will start with Streptococcus Pneumoniae, which was previously known as Pneumococcal Pneumonia or Diplococcus Pneumoniae. Of course, Diplococcus we will see in the morphology of this organism. It's composed of two cocci linked together with a capsule. So that's why they called it Diplococcus Pneumoniae. Epidemiology. Pneumococcal diseases are usually endogenous diseases. Of course, the word endogenous means that they are a normal flora. They can be a normal flora in our body. The organism is carried in the upper respiratory tract by 5 to 70% of the general population. لما بتوصل لنسبة 70% يبقى معناها الأورجانيزم منتشر جامد قوي in the population. Young adults generally develop lobar pneumonia, which is a primary infection. واحنا اتفقنا كلمة primary infection يعني الشخص بيبقى normal person وبيجيله this kind of pneumonia، فبتبقى primary infection، ودي عادة بتيجي for adults. وبيسموها lobar pneumonia because it involves the lobe of the lung. The second kind is usually occur in children and elderly, and it is more likely to be a secondary infection, and we call it bronchopneumonia. عموما, the pneumonia caused by this organism occurs when the patients are with impaired immune system or increase in the aspiration of the respiratory secretions. يعني ايه aspiration of respiratory secretion؟ يعني الافرازات بتبقى عالية بتاعة الايه الموجودة في الصدر في الرئة. فده بيكون نتيجة ايه؟ upper respiratory tract infections، يعني واحد عنده another upper respiratory tract infection and then it is complicated by this organism. It usually occurs برضو بنسبة عالية in the heavy smokers، الناس اللي بيدخنوا كتير سجاير. الالكوهوليزم اللي هم الادكتس بتوع اللي بيشربوا كحول او يعني خمره ومدمنين الخمره، دي مقصود بالكوهوليزم. السيكل سيل ديزيز اللي عندهم برضو مرض فقر في الدم. الناس اللي بيعانوا من الكانسر او الكونجستيف هارت فيلير etc. يبقى دي كلها امراض different cases بتساعد حدوث this kind of infection. الجنرال فيتشرز او نقول المورفولوجي of this organism مكون من ايه؟ اولا شكله as we see here it is called lancet shaped اللي هو as you see in this picture. They are cocci بس it's not completely spherical. بنلاحظ ان الجزء بيبقى مدبب، الاطراف بتبقى مدببه وفي النص اللي هو الجنكشن between the two cells مع بعض بتبقى straight. فالشيب ده بيبقى عامل زي the head of الارو، زي الرمح، زي بوز الرمح اللي هو من ناحيه بيبقى يعني عريض ومن ناحيه مدبب. فعشان ده كلمه lancet معناها كده، يبقى lancet shaped organism لان هو شكله زي الايه راس الرمح. Of course it is non-Lancefeld، واحنا قلنا الكلام ده في الانترودكشن بتاعت الستريبتوكوكاي ان هي بتبقى non-Lancefeld والفا هيموليتيك. بس كلمه الفا هيموليتيك دي هيبقى لها يعني ناخد بالنا ان احنا هنغير كلامنا شويه كمان شويه، هنقول حاجه تانية على انها تبقى الفا هيموليتيك. The virulent organism are encapsulated. الكبسول اللي هو زي ما باين في البيكتشر هنا، the capsule اللي هو بيحيط ال two cells together، يبقى الكبسول surrounds both cells together. فبنقول هنا each pair together are surrounded with a capsule composed of repeated polysaccharide units. يبقى هنا الكبسول is made of polysaccharide. مختلف عن ايه؟ different from Streptococcus pyogenes if you remember. ان احنا قلنا التاني كان من ايه؟ من hydrated hyaluronic acid، بس هنا it is made of the normal polysaccharide units. Almost 90 capsular serotypes have been described. طبعا وظيفة الكبسول زي ما احنا عارفين it protects the pneumococci from being phagocytosed. If it loses the ability to form this capsule, we call it in this stage, in this case, rough strains. The rough strains are non-virulent. They lose their virulence if they lose their capsule. ليه? Why? As they are rapidly destroyed by their own hydrogen peroxide. لو حصل لهم حتى phagocytosis, if they lose their capsule, of course, they are easily phagocytosed. And when they enter the phagocyte in the phagocytic vacuole, they will produce hydrogen peroxide. And بيحصل accumulation of this hydrogen peroxide. And as they possess no catalase or peroxidase enzymes, فبيقدروش يكسروا the hydrogen peroxide. So they get destroyed by their own hydrogen peroxide. ده بيشرح ليه it is very important for this organism انه to stay with the capsule. It's very important for its vitality in our body انه يكون عنده الكبسول. Immunity to pneumococci and recovery from the infection depend on the formation of capsule-specific antibodies. يبقى إذا this capsule is antigenic, our body can produce specific antibodies against this capsule. And this helps in our immunity and recovery from this organism or from this disease. Diseases caused by this organism. But, however, recurrent infection occurs. يبقى معناها إن a person can be infected by this kind of organism dozens of times in his life. Why? Because of the high number of the serotypes, which we said that they can reach to 90 different serotypes according to the capsule. When this organism is incubated anaerobically, the pneumococci produce a beta hemolysis or causes beta hemolysis on the blood agar. عشان كده قلت لكم في الأول إن إحنا بقول ألفا هيموليتيك، بس في هنا يعني خطين تحتها إن ممكن is converted from being alpha hemolytic to become beta hemolytic in anaerobic conditions. Why? Because it can produce an enzyme called pneumolysin O, وده very similar to the one اللي احنا جبنا سيرته in the Streptococcus pyogenes اللي هو كان اسمه Streptolysin O. فstreptolysin O هنا it produces pneumolysin O similar to the Streptolysin O لدرجة كبيرة يعني, which is active only under anaerobic conditions. And that's why احنا قلنا في الأول if it is incubated anaerobically it can cause this beta hemolysis. تعالوا نشوف بقى infections caused by this organism. Pneumococcal infections. أول حاجة طبعا the first is pneumococcal pneumonia. This is the most common cause of community acquired pneumonia. It varies considerably with individual age, as we said in the introduction, a condition of crowdedness and occupation. Sometimes you can consider this disease as an occupational disease. But مين اللي can suffer from such this infection? الناس اللي هم working in certain occupations like working in factories producing toxic smokes or toxic gases or workers in the mines في المناجم. فدي حاجات كلها people can يستنشقوا can breathe toxic gases فبيعمل inflammation in the respiratory system فhelps بقى the infection of this kind of organism. The symptoms include sudden onset of chills اللي هي بداية الفيفر. الفيفر reaches to 40 degrees centigrade. Severe pleural pain بيبقى فيه pain جامد في الشست لدرجة إنهم ممكن بيسموا this disease as stabbing disease. They call it stabbing disease as if someone has ضرب حد بخنجر بدagger in his chest or stiletto. This pain is very painful, of course, something like this. فالبين هنا بيسموه stabbing as if it is a stabbing disease أو as if it is stabbing pain. There is accumulation of fibrinous exudates composed of red cell. يبقى composition of these exudates are red cells, bacteria, polymorphs and fibrin. عشان كده بنسميها fibrinous exudates. Of course, these exudates will cause edema in the lungs, and the patient develops a rusty colored sputum. Rusty color because it can contain blood. And of course, he will suffer from impaired respiration. يعني إيه, what does it mean impaired respiration? يعني he will have a rapid shallow breathing, rapid heart rate, he has general weakness, and he can suffer from anorexia اللي هي سدة النفس, has no appetite for eating. 25% of patients also can develop bacteremia, which may lead to sepsis and other complications like acute endocarditis or meningitis. Here we can see in this picture, هنا ده شكل الأورجانيزم بس مش واضحة, it is not clear, شوية صغيرة, بس هنا بنوري الجزء اللي هو حصل له inflammation in the lungs. The next picture will be more clear to show us the bronchopneumonia, how this part of the lung changed in the color. فقدت كمان انها تبقى spongy like the normal lung. النورمال lung بيبقى لونه pink in color, بيبقى spongy, ده بيبقى heavy in weight وبيبقى طبعا مليان بالاكسيوديتس والcolor بتاعه بيبقى فيه black in color as you can see this picture. Number 2, pneumococcal meningitis. And pneumococci can be considered the second most prevalent cause of meningitis in adults. Of course, the first cause is Neisseria. You took it طبعا with Dr. Huda. But the second cause is this organism, which causes a purulent form. This occurs following bacteremia. يعني how can the bacteria reaches to the meninges? It starts with bacteremia, or head trauma like car accidents, or any kind of injury in the area of the head, or malformation. Sometimes a malformation can lead to the يحصل blood brain barrier يحصل فيه defect فبيخلي enables the organism to reach easily to the meninges. What is the meninges? Here this pictures shows you what is the meninges. The meninges are the membrane which covers the brain or the spinal cord. So بيحصل inflammation in this membrane, and this is called meningitis. Okay. Symptoms of meningitis. Mainly there are 6 main symptoms of meningitis. They include a fever, a severe headache, nausea and vomiting, stiff neck or neck stiffness, photophobia اللي هي sensitivity to light, and petechial rash. In this picture we can see the neck stiffness of this child and the shape of the characteristic rash of meningitis. The next picture will show us something else. It is certain signs, signs أو reflexes when a physician tests أو بيحاول يكشف على الطفل اللي هو عنده meningitis فبيعملوا فبيظهر these signs. The first picture, if the physician moves the head, طبعا الأول الطفل زي ما انتم شايفين نايم على ظهره sleeping on his back, and then the doctor begins to push his head upwards, a reflex occurs that the knees of the boy will also goes up. يبقى هيحصل reflex. دي بيسموها Brudzinski's neck sign. Of course you don't have to learn how to study this word. The next sign is called Kerning's sign. برضو الطفل sleeps on his back, and then the physician starts to try to straighten up his leg. He couldn't straighten up his leg 90 degrees with his body. He can't move it more than this. زي ما انتوا شايفين the arrow، الني هنا stuck، ما تقدرش يرفع رجله تبقى متعامدة على جسمه. يبقى these two signs بيبقوا indication للمننجايتس. اوكي. Number 3 otitis media. otitis media اللي هو التهاب الأذن الوسطى. Pneumococci causes most cases in children. يبقى هي the most برضه cause of otitis media in children. بيحصل فيها ايه؟ بيحصل swelling of the soft tissue in the ear و collection of the pus. طبعا الباس ما بيحصل له collection زي ما انتم شايفين in this picture، بيبقى كم كبير من الباس بيبقى collected here، فبيبتدي يعمل pressure على الاير، فبيبقى فيه extreme pain and temporary loss of hearing لو ما تعالجش. وهنا الطفلة دي عملوا لها هنا عملية بحيث ان هم شفطوا الباس اللي كان موجود beneath أو ورا her ear. فبيحصل loss temporary loss of hearing، بس بترجع الشخص الطفل يرجع تاني سمعه الطبيعي بعد العلاج. Laboratory diagnosis. The X-ray help to determine the nature of the disease, of course, but a laboratory diagnosis begins with ناخد sample from sputum or from the blood على حسب الحالة. Then it is cultured under carbon dioxide to give an anaerobic condition on blood agar containing gentamicin. يبقى blood agar هنا و anaerobic condition يبقى هيحصل ايه complete hemolysis لل RBCs. والgentamicin is added in the media as it to make it selective لأن organism can grow on the gentamicin. And then undergo gram staining. ELISA or counter immunoelectrophoresis or agglutination test can be used to detect the antigens in the blood. There is a very important بقى characteristic test، ده يعني مهم ان انتوا تعرفوه، اللي هو test depending on its high bile solubility. And by this test we can differentiate between Streptococcus pneumoniae and the other Streptococci species, which are bile insoluble. البile solubility دي is due to A, and the bile acts as a surface active agent. And also optokine disc, when we are going to speak about the optokine disc, it برضو acts as a surfactant. This surfactant activates the autolytic enzymes of the organism, so helps the hydrolysis of the peptidoglycan. فبالتالي بيحصل ايه للبكتيريا؟ يحصل لها lysis. فit appears as if it is dissolved. بس هي مش عملية solubility، هي عملية ان بيحصل لها lysis by the high bile dose. The same idea using commercially available optokine discs. The pneumococcus is inhibited by the optokine disc, but the other streptococci برضو are not inhibited. So by these two tests, these are characteristic tests you must know for this organism. They are also highly virulent to mice. So if you inject sputum or spinal fluid intraperitoneally into a white mouse or rabbit, if السبيوتم ده فيه الأورجانيزم هيحصل death of the mouse or the rabbit within 1 or 2 days. بس طبعا التست ده هيبقى مكلف، فبيفضل يعني التست اللي هو بيستعمل أكتر number 3 and number 4. Treatment. Penicillin G is still the recommended treatment, but sometimes we undergo sensitivity testing and we choose the most appropriate antibiotic, such as cefotaxime, imipenem, or vancomycin. For prevention, patients at high risk for pneumococcal diseases, طبعا who are at high risk, الناس اللي عندهم مناعة ضعيفة, people who suffer from low immunity, they should be isolated from pneumococcal cases. And of course, it's better for them to take a vaccine. There is an available vaccine for adults. So adults at risk should also be immunized periodically. The vaccine must be taken every 6 years. We call it pneumococcal vaccine. It is composed of polysaccharide. They choose 23 of the capsular types. So the vaccine is called 23 capsular serotypes composed of 23 of these serotypes, which represents 85 to 90% of those that cause the invasive disease. This vaccine, بس بنقول this vaccine is only suitable for adults because, as we said, it is made of polysaccharide. From your طبعا knowledge إن البوليساكرايدز are T-independent antigens. ففي حالة الchildren، وطبعا الchildren في الage الصغير اللي هو below 2 years of age, they have this kind of immune response is not established in their body, so we have to find another vaccine for children. For children aged from 2 to 23 months, a new heptavalent vaccine now is available. We call it Previnar or PC7V7. 7 stands for being heptavalent. فبتتكون من 7 من السيروتايبس. دلوقتي there is another one available also which contains 13 serotypes. This conjugate vaccine is composed of a part اللي هو البوليساكرايد of the capsule of the Streptococcus pneumoniae and part a protein. This protein part they choose to prepare it by the diphtheria toxoid. So they make the conjugate vaccine between the polysaccharide of Streptococcus pneumoniae and diphtheria toxoid. So this will give good immunity for children under the age of 2, where a significant amount of the disease may occur. Now we're going to start with the gram-positive non-spore forming rods. يبقى خلصنا الكوكاي، هنخش في الرودز. هنبتدي بالnon-spore forming rods. Number 1 is Corynebacterium diphtheriae اللي هي the causative organism of the well-known diphtheria. مرض الدفتيريا، حتى بالعربي بنستعمل كلمة دفتيريا، بس بالعربي مفروض الاسم بتاع المرض الخناق. الخناق طبعا جاي من هنشوف السيمتومز بتاعة المرض ان هو بيسبب ان البيشنت will be suffocated and he will not be able to breathe. The word coryn is a Greek word, means club due to the shape of the organism. As we see here, the organism is rods, but at the end of the rod there is a part which is bulging, شوية تخينة في الأطراف. This bulging أو this shape is called club shaped. الدفتيريا بقى, the word diphtheria is also a Greek word which means leather, يعني جلد, due to the leathery pseudomembrane which is formed in the patient's throat. اللي هي هنشوفها of course in the symptoms of the disease. The morphology and characteristics, it's a gram-positive, non-spore forming, as we said, non-motile. الشيب بيبقى pleomorphic rods, يعني مش كل rods are typical the same shape. Some are straight, some are curved, and some are club-shaped as we explained before. As we see here, بعضهم بيبقى دغري straight خالص، وفي بعضهم شوية curved, slightly curved, وطبعا في منهم اللي هما club-shaped. The stain smears show many cells forming sharp angles with each other. The arrangement of this organism is known as the Chinese letter shaped أو Chinese letter arrangement. As you see here in the picture, الrods عاملة مع بعض right angles together, متجمعين وعاملين أشكال. The shape of this arrangement looks like the Chinese letters, زي الكلام الصيني. If it is stained with methylene blue, it is stained irregularly, which is also seen here in the picture. You can see the purplish metachromatic granules. This violet or purple color is due to storage deposits of energy materials, which is actually عبارة عن pockets of inorganic phosphate. Epidemiology. Diphtheria is known from a very long ago to be a disease of childhood, usually infecting children from 5 to 9 years. So this was the most susceptible age. However, today people rarely think about diphtheria. دلوقتي diphtheria is not مش منتشرة. This is because the immunization program, which is very successful in reducing both the number of the cases and the number of the carriers. ولكن although this, it is still not safe. However, it is still not safe to assume that diphtheria is a disease of the past. ليه؟ لأن في لسه لغاية دلوقتي until recently there are small outbreaks occur especially in developing countries. In the vaccine era, there has been a shift in the age distribution. Rather than being a childhood disease, now we found the new outbreaks, we recognize that the age distribution shifted towards the adults above 14 years. And this was very obvious in a certain report since 1994. It occurred in Russia. An epidemic occurred in Russia, which reported over 75,000 cases. تلتين these cases, الحالات دي, were in the age above 14 years. طب how can we explain؟ ازاي نشرح ليه حصل الشيفت بتاع الage susceptible age to the adult age? This age shift can be explained by, first, the children are mostly protected now by the immunization. You know, the immunization program is compulsory, يعني إجباري, so all the children are protected. And at the same time, the adults became more susceptible because exposure to the toxigenic organism became rare. لأن في الأول كان children نقدر نعتبرهم هم reservoir of infection. فلما ما بقاش في spread of the organism in the environment, adults are not going to acquire the natural immunity against the organism. And at the same time, if this adult has taken the vaccine when he was a child, the vaccine-induced immunity wanes over time. Wanes يعني weakens, يعني تضعف over time, unless periodic booster doses of the toxoid is given, which is supposed to be taken every 10 years. The mode of infection, Clostridium diphtheria may be carried as commensals, كلمة دي تانية برضو بمعنى normal flora, in the upper respiratory tract. وin the tropical region, في المناطق الاستوائية, الأورجانيزم ده موجود as a normal flora on the skin. فبالتالي, thus, their spread may be either by inhalation of the respiratory droplets في الحالة الأولانية in the first case, or by contact with the infected skin in the second case. Also, this organism can be transmitted through the dried pseudomembrane fragments اللي هي بتتكون in the throat of the patients. لأن these fragments of the dried pseudomembrane can harbor, the organism can stay alive in these fragments for more than 3 months and can serve بالتالي as a source of infection. Mechanism of pathogenicity. عايزين نعرف virulence factor of this organism. There are 2 critical virulence factors. Number 1 is diphtherial cord factor. This contains mycolic acid, and it is similar to 2 other organisms اللي هم Mycobacterium tuberculosis, mainly ده مشهور قوي ان هو بيحتوي على mycolic acid, والنوكارديا. وبوث ان شاء الله هناخدهم مع بعض باذن الله. We're going to deal with both microorganisms in our lectures ان شاء الله. So they call this group of microorganisms who contain this mycolic acid the CMN group. C stands for Corynebacterium diphtheria, M for Mycobacterium tuberculosis, and N for nocardia. So the 3 organisms contain this mycolic acid which is toxic to the host cell. يبقى ده يعتبر the first virulent factor. بس it is not very important في حالة الدفتيريا. المهم في حالة الدفتيريا طبعا الدفتيريا toxin. Sorry. الدفتيريا toxin is type AB bacterial exotoxin, التوكسين اللي احنا اتكلمنا عنه. We spoke about it in our first lecture وشفنا عليه مفروض فيديو بيبين لنا الميكانيزم of الexotoxin. It's also lysogenic, only produced by lysogenic bacteria. بفكركم تاني إن شاء الله المرة الأخيرة هفكركم بيها يعني إيه lysogenic. يعني there is a bacteriophage, a virus infecting the organism, and he who is the one who provides the bacteria with the tox gene. so it can produce the toxin. يبقى without this phage, the bacteria cannot produce the toxin, and we consider it non-toxigenic. يبقى التوكسيجينيك بكتيريا اللي هي البكتيريا اللي هي infected by the phage, and it is lysogenic. So only lysogenic bacteria produce this toxin. It is a cytotoxin, يعني it kills cells, which causes inhibition of the protein synthesis. يبقى الميكانيزم of action إنها بتعمل inhibition للبروتين synthesis by the inactivation of elongation factor 2 اللي هو موجود بس في اليوكاريوتيك cells اللي هو زي elongation factor G in the bacterial cells اللي هو ليه دور very important role in the protein synthesis. So when it causes inactivation of this elongation factor 2, the protein synthesis will stop and the cell will die. طب ايه انواع السيلز اللي هو بيأثر عليها؟ They affect on certain cells because it has certain binding receptors to these cells. ايه هما السيلز دول؟ الميوكارديال cells, renal cells and the nerve cells. Certain nerve cells والrenal cells اللي هي في الكدني والميوكارديال cells اللي هي المسلز of the heart. يبقى إذا التوكسين هنا can bind to these three target cells, not to any other cells. شوف الكلينيكال بيكتشر. الانكيوبيشن period from 2 to 4 days. طبعا مش لازم we mustn't يعني تحفظوا by heart these days. يعني it's a short time. You can just memorize it is a short period of incubation from 2 to 4 days. The organism lodge in the throat. دي كلمة مهمة قوي lodge in the throat. احنا شفنا في الستاف والستريبتوكوكاي ان البكتيريا كان لها very وسميناها invasive bacteria. كانت لها قدرة على spreading in our body. تتنقل من مكان لمكان وتعمل infections في أماكن كتيرة في الجسم. But here this Corynebacterium diphtheria it lodges and it stays in one place in our body. It doesn't have a spreading ability in the body. So it lodges in the throat. Lodge يعني يسكن. So it stays in one place in the throat, causing sore throat and moderate fever. يعني ممكن infection كده في بدايتها it appears like a strep throat. بيبقى فيه fever, sore throat and cervical soft tissue swelling. It can be like this and الانفكشن تقف على كده. امتى يحصل كده؟ لو كان this organism is not toxigenic. If the organism is not toxigenic, it can produce symptoms, mild symptoms like strep throat, and you cannot differentiate between it and between the streptococci. تعمل شوية pharyngitis and that's all. ولكن we will continue بقى to see بقى the role of the toxin if the organism is toxigenic. فبيحصل زي ما قلنا fever, cervical soft tissue swelling and lymphadenopathy اللي هي البول neck. And you can see here in this patient, this child, his neck is ايه؟ حصل لها swelling وباينه قوي هي شكل البول neck اللي هو ايه؟ الطور. يبقى الرقبه عامله زي رقبه الطور. Then characteristic pseudomembrane of the diphtheria will begin to form in the throat. This pseudomembrane consists of what? It consists of fibrin, bacteria, hosts, leukocytes, RBCs, and dead tissue cells. يبقى دي the composition of this pseudomembrane. يبقى هي بتبقى موجودة فين؟ As you see here in this picture, السودوممبرين اهي اتكونت الجزء الأحمر ده dark red in color. It is the pseudomembrane. وحصل airway obstruction due to the pseudomembrane. نكمل الكلام هنا. If the patient is not immune, ما خدش الفاكسين, and the organism is toxigenic, إيه اللي هيحصل؟ What will happen? The membrane may extend to the trachea and there will be the risk of suffocation. يحصل الاختناق اللي احنا قلنا سمينا المرض على اسم الايه؟ الخناق. وفي الحالة دي عشان ننقذ الطفل to rescue this person, tracheotomy is a must. هنشوف picture بعد كده نشوف فيها عملية التراكيوتومي دي عبارة عن فتحة is an opening in the trachea from the neck so that the person can enable him to breathe. The organism will produce a diffusible exotoxin. يبقى هنا الorganism lodge in the throat ولكن الtoxin is diffusible. It will move in the blood causing life-threatening systemic effects. It is highly toxic toxin لدرجة in 0.01 milligram, a fraction of a milligram of this toxin can kill a person 90 kilograms in weight. تاني هنا بنقول there is no spread of the organism. بنأكد إن الorganism doesn't move from the throat, doesn't spread in the blood. Instead, the toxin will travel through the blood to its target organs, causing, if it goes to the myocardium cell, cause myocarditis, and this is the cause of 50% of the death due to myocarditis, causing nephritis and paralysis. But the paralysis to certain muscles, not all the muscles are involved. It's only involvement بيبقى soft palate, eye muscles, and the extremities, and it is reversible. This paralysis is reversible. يعني الشخص لو أخذ العلاج السليم, if he was treated, حصل, it is curable and the paralysis will go away. يعني هيرجع المسلز تشتغل تاني normal after treatment. هنا بنشوف symptoms of diphtheria. You can see the pseudomembrane appears in the throat. وهنا this 10-year-old boy with severe diphtheria. He also suffers from conjunctivitis. Pharyngeal membrane اللي هي pseudomembrane اللي احنا بنقول عليها. Bull neck, you can برضو recognize here the neck is فيها هنا enlargement. الbull neck, severe myocarditis. زي ما باين هو تعبان أنا مش قادر يقوم من السرير. And في الحالة دي all vaccines are contraindicated. It's not safe to take any kind of vaccine. And this picture بتوري لنا التراكيوتومي, الفتحة, opening in the neck, in the trachea, so the person can breathe. Cutaneous diphtheria. المفروض ما ننساش ان برضو زي ما قلنا في الاول ان الانفكشن ممكن تكون على السكين or in the throat. ففي حالة الcutaneous diphtheria which occurs in the tropics, المناطق الاستوائية, the organism may produce wound infection which appears as ulcers. يبقى هي begins as a wound and then this wound يحصل له complication بالinfection بالorganism. بتسبب ulcers with grayish white membrane which hardly heals. وفي مشكلة تانية another problem إن عادة بيحصل كمان معاها secondary infection with Streptococcus pyogenes and Staph aureus مع السكين infection دي, فبتبقى صعبة قوي الهيلينج بتاعها وبتبقى متغطية covered with the pseudomembrane. طب what about the toxin in the case of cutaneous diphtheria؟ بيقولوا إن التوكسين هنا الabsorption from the skin is much less than from the nasopharynx. يبقى هنا الموفمنت أو الانفيزفنس يعني بتاعت التوكسين بتبقى أقل كتير قوي في حالة السكين انفكشن عن في حالة nasopharynx infection. Laboratory diagnosis is throat swabs or tiny pieces of pseudomembrane. These tiny pieces of pseudomembrane المفروض يكونوا dried pieces. مش اجي انا بالفورسبس ان انا احاول اشد السودوممبرين بالعافيه من الثروت of the patient. لو حصل كده بيحصل profuse bleeding. لكن لازم تبقى dried pieces of pseudomembrane. Should be obtained and stained with methylene blue. You can recognize the club-shaped bacteria showing the Chinese letter shapes. A selective media of diphtheria في lofular agar عبارة عن coagulated blood serum. ده selective media for the organism. في blood tellurite agar متكون من composed of potassium tellurite. It is added in the agar to inhibit the growth of other respiratory isolates. Colonies of the corine bacteria diphtheria acquire the typical black color as you see here in the picture. Colonies بيبقى لونها black in color due to the precipitation of the tellurium metal inside the cell. فبالتالي السيل بتبان باللون الأسود. test for toxigenicity. احنا عرفنا ان هو عندنا we have Corynebacterium diphtheria from the previous test, but is it toxigenic? أو another word, can it produce the toxin? يبقى لازم أعمل تيست أتأكد إن هي toxigenic bacteria. This test is called Eleg Test. It's composed of a strip of filter paper as we see on this plate. البليت ده عبارة عن serum agar plate. وبنعمل placement لstrip in the middle of the plate. الستريب دي بتبقى impregnated يعني بدخلها soaking. I soaked it before in the specific diphtherial antitoxin. يبقى هنا الستريب ده عليها الانتيتوكسين بتاع الديفتيريا. بعد كده باجي ازرع العينات بتاعتي بتاعت samples of the Corynebacterium in lines perpendicular on the strip as you see in the picture. بعد كده بعمل لها incubation to allow the organism to grow. لو الorganism is toxigenic, it will produce a toxin, and of course بيحصل diffusion of the antitoxin in the agar. فat a certain concentration اللي هي optimum concentration between the toxin and the antitoxin, لو وصلت ل this concentration بيحصل precipitation. ف this precipitation will happen لو حصل إن الorganism produce the toxin. ف we will see this زي ما انتم شايفين هنا in the picture. These are the arc of precipitation. So this strain and this strain are toxigenic because they produce the arc of precipitation, and this one is non-toxigenic. Neither this one is, although it's also non-toxigenic. Prevention and control. طبعا first of all isolation of the patients. As we زي ما احنا شفنا, it is easily transmitted from person to person by droplet infection or by skin contact في حالات cutaneous diphtheria, so isolation of patient is important. Number 2, detection and treatment of carriers. لأن carriers برضو كان الشخص اللي هو خلاص حصل له خف يعني من المرض ممكن يفضل شايل الorganism in his throat for several months. So we have to detect and treat carriers. Number 3, active immunization. Vaccination which is compulsory يعني إجباري by the diphtheria toxoid, وطبعا toxoid اللي هو التوكسين وبنعمل له inactivation by formalin, which is usually mixed with tetanus toxoid and pertussis vaccine اللي هو well known vaccine triple vaccine. D stands for diphtheria of course, T for tetanus, and P for pertussis. This vaccine consists of 5 doses. The first 3 doses starts at the age of 2 months, then 4 months, and then 6 months of birth. Then the 4th dose about 18 months, and it's completed by the final dose at 4 or 6 years of age. But this childhood vaccine should be or needs booster doses for adults every 10 years. بس في الحالة دي, in this case for adults, we don't give them the childhood vaccine, we give them the TD vaccine. This TD vaccine is composed of tetanus, and الدوز بتاع الديفتيريا بيبقى little dose تقريبا 1/10 of the dose in the childhood vaccine. So that's why we write it in a small letter. But T is capital and D is a small letter. So this vaccine, this is the adult vaccine, is supposed to be taken every 10 years. Treatment, early administration of specific antitoxin. This is the most important treatment is the antitoxin. As once the toxin has bound to host cell, it is irreversible. عشان كده بنقول early administration. لازم نلحق quickly give the patient this specific antitoxin. This antitoxin works mainly on the B subunit. That is to say, it prevents the binding to the target. So once it's bound, it is irreversible. So you must treat the patient very quickly عشان ألحق التوكسين قبل ما يحصل له binding. So we have to give early administration of the specific antitoxin. This antitoxin is administered intravenously first عشان برضو يبقى سريع، يبقى intravenously, then continue treatment by intramuscular injections. About 50,000 to 100,000 units ده الدوز بتاع التريتمنت. الانتيبيوتكس، هل الانتيبيوتكس مهمة في الحالة دي؟ احنا بنتكلم على توكسين، ممكن اقول ما فيش داعي no need for giving antibiotics. It will have no action on the toxin. No, we still give antibiotics because as erythromycin or benzathine penicillin G are used for 2 or 3 even reasons. Number one, to prevent the formation of more toxin by killing the organism اللي هو مصدر التوكسين because it is the source of the toxin. Number two, to eliminate superimposed group A streptococci or staphylococci, which may cause complication of the infection. So that's why we also give antibiotics. And finally, to prevent the organism from persisting in the patient after recovery, عشان ما يتحولش to become a permanent carrier or a nasal carrier. فعشان كده we always give also antibiotics. يبقى mainly a specific antitoxin ومعاه الانتيبيوتيك. وكده we finish our lecture. Thank you for listening. وإن شاء الله نتقابل in our next lecture بإذن الله.